Today we actually have a returning patient of ours that we've already done an ingrown nail. This is actually 2 weeks old, so it's really cool to see how much healing the patient already has at 2 weeks. There's no pain on the sides. You can see the nail is nice and square and has a very normal appearance. So now we are actually getting ready to go ahead and do the exact same thing to her other toe. This toe has already been numbed up. We've done the injection already. First thing we're going to do is put our toe tourniquet or tourniquet on the toe. So once that's nice and clean, I always test to make sure that there is no pain. ¿Algún dolor?
No.
Perfect. So there's no pain for the patient. Okay. So all of you who have watched these procedures before, first thing we do is we take our freer elevator or a straight edge elevator, and we're just loosening up the nail border from the nail plate. We're going in and around the sides on the top of the nail until we feel some resistance. Once that's done, we switch underneath. We find the lip of the nail, and once we do that, we advance the freer all the way down. You can see with the toe tourniquet, there's really not that much bleeding at all. So it creates a very clean environment for the procedure to be performed. So same thing here, we're going above the nail, in between the nail and the actual nail fold. Now you're gonna flip over, find the lip of the nail, gently advance the freer down. So now we can come in with our nail splitter or English anvil. There's many different names. It's got a flat edge with a cutting edge on the top. And this is what we advance underneath the nail. First we do one cut, and that creates the path. And then once we've done that, we advance it all the way down. And that's it, one cut's done. And now we're going to do the other side. So halfway through, make a cut, creates our path, advance, and there you have it. Both cuts are made. So now this is the satisfying part. You're going to take your hemostat, you're going to advance that all the way along the length of the nail that you've split. You want to make sure it's all the way down, and you're going to turn away from the nail. And that's going to allow you to grab not only the nail, but the nail root. And I like to inspect it to make sure that we've done that, because the nail root has a very unique appearance. It has a white appearance, which tells us that's the root. So we're going to do the other side, advance the hemostat all the way down, clamp down, turn away until you see the nail root, and there you have it. So those were the two pieces of nail that were in there. Make sure you grab all of that debris. And what's cool to see is that even though we've taken out a good amount of nail, as you can see, that is a very normal appearing nail. Right, so this patient's going to have a very good aesthetic looking toe when it's all said and done.